High resting heart rate increase risk of death. That's why resting heart rate is considered independent risk factors for death. Now let's say what is normal heart rate. Normal heart rate usually is 60 to 100 beats per minute. In athletes and physically well-trained people, it can be lower, such as 40 to 60 beats per minute. And now let's say what is maximal healthy heart rate during physical activity. We should calculate for any person, and it's 220 subtract your age. For example, if person is 40 years old, its maximal healthy heart rate can be 180 beats per minute. It's of course during physical activity, external physical activity. Now let's say why is so bad high resting heart rate? Because it increases risk of stroke, myocardial infarction, diabetes, Alzheimer's disease, and even some cancers. And we can say that every additional 10 beats per minute increase the risk of stroke around 30%. It's almost same in case of myocardial infarction, diabetes, Alzheimer's disease. In case of cancers, risk is increased about 8% per additional 10 beats per minute. And we should mention that person can have healthy range of resting heart rate. For example, it can be 80, and 80 technically is considered normal. But if person's previous heartbeat was 60 and now it's 80, it's additional 20 points. So it increases risk of disease and increases risk of death, of course. Now let's say what is heartbeat, normal heartbeat during different physical activities. In case of walking, it's around 110. In case of jogging, it's around 130. When we say 130, we mean that it can be 120 to 140. So we're saying average, not exact numbers, of course. In case of running, it can be around 150. Of course, it can be 160 and it can be 130. Intense running, it's usually 170. So optimal heart rate during very intense physical activity should be around 50 to 85% of person's maximal heart rate. So if you are 40 years old and your maximal healthy heart rate can be 180, at this case, during external physical activity, your heart rate should be around from 130 150 range. More is not favorable. During sex and masturbation, if it's passive, heartbeat is around 110. In active cases, it can be 150. And as a general tendency, we can say that lower the heart rate is better. I mean in case of resting heart rate. But if person has faint, weakness, dizziness, chest pain, difficulty breathing or other symptoms, while this person has lower heart rate, it can indicate heart rate problems such as bradycardia and different types of heart problems. So it's not favorable, of course. So in generally healthy people, the lower heart rate, the better. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.